Dumelang, re buile hape ka episode ya rena ya NBS, Next Business Solution. My name is Maureen Rapolo. I'm the host. I'm not alone. I am with my co-host, Kay. Today we have a very amazing lady, Sister Lizelle Nudia, the international and nationally acknowledged wound care practitioner. She has been in the business for more than 25 years. Wow. Okay, Sister Lizelle. It is very nice to have you today, I must say. We have been waiting for this day to happen. And then this is, the idea around having you come in here is because of the DMs that we have been receiving about wound. That made me realize the need in the wound care space, that people need to know how do we go about, what is wound. Can anyone do that? I just want to welcome you today. So, we've got some questions prepared for you. The first question will be, can you tell us about your journey in the wound care business, please?
Okay, well, my journey started, I think, as a student.
Okay.
And I do believe that wound care chooses you,
Wow.
not the other way around.
Okay.
So when I started, wounds were sort of like always part of who I am. And in 2000, I started my own wound care practice.
Okay.
Many moons ago, 25 years ago.
What?
And I started my own wound care practice in 2005, and then become part of the Wound Healing Association of Southern Africa. And I think that was sort of like the start, and the rest is history. I became president of the Wound Healing Association.
Wow. Oh, nice.
Founding member. We established the Wound Healing SA Journal, which is a peer-reviewed journal in South Africa.
Oh, beautiful.
And I ran my own clinic.
You went far with the starting of the wound care, and in most cases, I would think that a lot of people are like quite afraid of wounds and stuff like that. You know, it's so bizarre that you would actually go deep in it. What even fuels that?
The irony is, when I started my own practice, I decided there's a lot of wound care practitioners out there. I'm going to do everything else. So I'll be doing everything that comes my way. So I did home nursing. I did everything.
Oh, okay.
In the middle of the night.
Wow.
And I called I was a newbie. So when you're a new wound care practitioner,
Yes, you'd want to
we
trial.
call them newbies.
Okay.
And I practiced out of I had a little blue Corsa
Okay.
motor car.
Okay.
And I was a boot sister. So I practiced out of the boot of my car and went and did home visits. That's how I started.
Oh, you were practicing privately.
Privately, out of the boot of my car, starting that.
From being a nurse, so which unit have you worked in as a nurse?
Everywhere.
Bedside?
Bedside, yes. I worked in the medical environment. I worked in private companies as well, so like the Mary Cross systems and trauma and all of that. Didn't do ICU, and I think if you tell me now to go to ICU, it's going to be, don't do that.
Oh, why?
Because I'm so focused into wound care and advanced wound care.
Fell in love
I
with
think the technology in the ICU environment is far different when I, 25 years ago, practiced in ICU specifically. So my speciality is wound care.
Yeah.
And looking at the technologies in wound care and developing that. So part of my journey for the last 25 years is product development, research. But what I'm most passionate about is education.
Yes.
Because the more people we train,
Yes.
the more people we can help.
Yes.
Wonderful.
That's true.
So that's part of who I am. I remember when I did my first educational series, and I think it was in 2003.
Okay.
I did a course with Hertfordshire University in the UK. And at the end of the course, they asked us, what are you going to do with what you've learned? And being Liesel, I stood up and said, well, I want to start my own training academy. Because I need to tell people more about wound care.
True.
And so in 2005, I started Eloquent Learning Health.
You moving,
2005.
She's moving.
Yeah, 25 years.
Similar to what Maureen's doing at the moment. The difference was, when I started, there was no support. There was no real support from people on how to administrate a business, How to start your own business,
that,
really.
that was gonna be my next question, to say what were the challenges then with to structure your business and that you faced that time.
I'm so glad you asked the question.
Yes.
Because in the medical profession, we're not taught business.
Yeah. Yes. Yes.
Administration, billing systems. I mean, Maureen, you know.
Yeah.
There are so many things out there. Which one do you choose? Which telephone system do you use? Do you need to get your different phones? What card exists? What do you write on? How do you record? Where do you order your stock?
Definitely.
You're not taught
all
that
the
at all.
nitty-gritties.
Yeah. So when I started, I think that was to me very difficult.
Yes.
And I even at that point, I remember I would go and see other nurses to see how do they operate their clinics. And I literally, doors were shut to my face, saying, no, we're not going to show you. And that was one of the reasons why I started the education as well. Because I felt like there were not a lot of people who did help me. There were a few practitioners that opened their doors for me and shared their experience. But overall, it was everyone for themselves.
Yeah.
And I do believe that has been changing over the past few years, and that we need to work together.
Yeah.
Definitely.
We need, like you're doing with Business Solutions, a group that works together. I mean, that was why I started with the Wound Healing Association of Southern Africa.
Okay.
Our core vision and our core principles was to be a multidisciplinary team, bringing people together, working towards the greater good for wound care in South Africa and actually Southern Africa.
Yeah.
Things change over years, and you need to work with the times.
Definitely.
You need to work towards getting a discipline recognized, which is currently not.
Yeah. Yeah.
And I don't know if with your experience, Maureen, I would like to put a question to you.
Yeah.
When you started out your own practice, because I mean you're also
I'm also
a wound care practitioner. We both are.
Mm-hmm.
There's currently no recognition, no formal recognition for wound care in South Africa.
Yes.
Okay.
So in the UK, we've got tissue viability nurses or experts. That's what the wound care practitioners called there. In the United States, we've got certified wound care practitioners.
Okay.
Or wound care certified practitioners. In South Africa, we don't.
That is very stressful situation, Sister Lizelle, because I get a lot of people who wants to know if the wound care is acknowledged by South African Nursing Council, and then where do they do the course and all of that. What would you advise someone about that?
So currently, there's no recognized, fully accredited course in South Africa.
Okay.
We don't have a qualification that says this person has done like a nursing degree or podiatry degree, and now they are a wound care specialist or an advanced
like
wound
we
care.
do with occupational health.
Occupational health.
And then where you will have a bar. So we don't have in the space of South African Nursing Council.
We don't have that.
I'm sitting here and I'm assuming maybe the reason for that could be that, you know, people overseas don't, or rather people here don't have the same problems with the people overseas, or is it a thing that maybe we don't see it as a very important thing to know?
It's
or is
very
it an
important.
arising, sorry, is it a very, is it arising now that people are starting to realize that they need wound care, or what? I'm confused there.
It has been like we don't have a wound, we don't have wound as a specialty from South African Nursing Council.
Because we don't have many wounds, or?
We do have wounds. We have wounds that needs to be focused on. We need to focus on the wound. It is seen by like a specialty, because a patient will have a wound and that needs to be taken care by someone who is trained to manage that. You understand? So that is the reason why Sister Lizelle decided to come with the training. Yeah, to focus on basic wound care, right, Sister Lizelle? And then I'm not sure if you are in a space where you also teach advanced wound care. Okay. Yeah, so it is. I think it's something that we need to talk about.
Look,
you know?
Before we go deep into the questions and everything, right, this wound care thing is actually very close to, like, you know, my personal experiences, where I was raised where we had a family member who had a huge wound on their leg, right? On the feet, rather.
Yeah.
There was like a hole that was being like dug, I don't know, right? And there was a stereotype that that was like African stuff, right?
Yes.
Where maybe they didn't take it serious, or they would think that there's no doctor who can fix it. So I would think maybe that's also the stereotype that makes maybe us here not to have that specialized practice. I don't know.
So it's interesting that you mentioned that
Yeah.
because that's a reality. We live in Africa.
True.
Okay, that's a reality. We've got different cultures,
Definitely.
we've got
Different
different
beliefs.
languages, different belief systems,
Yes, yes.
and so they play an integral part in how we deal with whatever we get in wounds specifically.
Definitely.
Have you been cursed? Have you not followed your religion? Have you had an angry family member who kicked you, and that's why, and this is the consequences? So those things are a reality. And also we sit with a situation where sometimes Western medicine and technology is seen as the enemy. So it's not part of what our healing perceives. And so people, I always say, if desperation's the indication, people will do anything.
True.
Okay? And part of that is, again, the educational level, is are people made aware of the consequence of why wounds are there? So why do you have a leg ulcer? So it's not just about the wound, it's about what's going on in the whole leg, what's your blood flow like. So I always teach my patients and my students about VIP. Not that you guys are not very important people, okay, you are.
Okay.
Yeah.
But it's a different VIP.
Okay.
Vascular infection pressure.
Okay.
Do you have enough blood flow? Yes or no? And we can test that.
Yeah.
It's not only about feeling the pulses, it's about we've got devices that can do that. Are there signs of infection in that wound? So are you seeing any signs of infection?
you
But
s-
if you don't know what it is,
Yeah.
how can you do something about
Yeah,
it? So
that-
it's an educational thing for both the patients, the
True.
caregivers, and the healthcare professionals. And the last part is P for pressure.
Yes.
Is there enough pressure or too little? So in a leg ulcer, you need to have compression to actually assist wound healing. And that can only be applied by an advanced wound care practitioner because they need to be taught how to do the bandage technique. A lay care worker or a family member will not be able to do that.
Yeah.
So we
Yeah.
need a speciality that can
Definitely.
perform that. The diabetic foot
Definitely.
is not an easy to manage disease and case scenario of wounds. So there's such a need for education in making sure that nurses out there, doctors, as well as podiatrists, all of that know about wound care. Because if you look in the way that we are taught, wound care is part of that, but it's basic wound care.
I wanted to say that.
And the
that-
short part of your
Yeah.
course, if you look at the training of doctors, a few years ago I was involved in the wound care training of the fourth-year students, and it was an
Okay.
hour lecture.
Okay.
That was the wound care lecture.
and that is not enough.
That's not enough for what's happening in wound care
Yeah.
and what has changed in technology in wound care. There's so many different products. There's so many different ways that we're dealing with wounds. And because one of the biggest problems that we're facing is antibiotic resistance.
Yes.
So you'll hear a lot of that in the media. That's covered
Yeah.
with infection control and so forth.
That's a real thing.
It's a real
It
thing.
is, it is.
Antibiotics doesn't have the same effect as it has previously.
Before.
That's one of wounds' biggest
Yeah,
challenge. I mean,
yeah.
you've probably seen that in your clinic as
A
well.
lot, so that you don't even know which one to use anymore, you
Exactly.
know? Yeah.
But the beauty of that is with good wound care, you don't need antibiotics. Not necessarily. Because the products that we use are like antibiotics, but they're topical. You apply directly on the wound. And you can see you need to have knowledge for that.
True.
Because there are so many different ones. If I think up top of my head, about 6 or 7 different types of antimicrobials, which iodine is only one of. You've got silver, you've got copper, you've got chlorhexidine. There's so many, and honey. I'm a huge lover of honey.
Okay.
Yes, honey is medicinal.
Yeah.
Definitely.
Yes,
Yeah.
and especially pure honey, so that you've got. I always get the question, sister, why do I need to buy the medical honey? Surely, Woolies and Spar and Pick n Pay, they've got
Have
good honey.
Yeah.
It's different.
Yeah.
It's different. They're pasteurized, so the
Yeah.
healing capabilities can be compromised.
We still love woolies.
We do
So-
love a lot of these companies.
Yeah, so it is very important. It is very important, Kay, that it's not about wound. It's not about the love or wanting to be in the wound care business or space because you want to make money.
Yeah.
It's actually about knowledge. You need to know wound as a whole. Because I always tell people that for the fact that there's a wound, that is an indication of something wrong. You understand? You can't just have a wound if you are in the healthy space of life, you understand? So we've got lower leg ulcer, we've got diabetic foot. Those will be the indication to say, hey, this wound. So it's very important what she's saying in terms of training, because then you will be able to differentiate that this wound from the get-go. Seeing the wound, then you'll be able to say this one is venous-related wound, then I need to treat it like this. All right. So
It's
then,
so important.
Yes.
So important.
yes. So, Sister Lizelle, how do you balance being a clinician and entrepreneur? Because I believe you've got Eloquent health and wellness as an umbrella, right? And then you've got training that in your umbrella. You also have wellness, and you are a wound care clinic. So how do you balance the whole three?
I think one of the biggest things is passion.
Okay.
Okay. And practice what you teach.
Okay.
For me, being in the field, doing wounds on a daily basis, assisting patients, I think I will never change that part of my character. And the real reason why I started out is serving others and helping others,
Okay.
and to better and empower people. So part of empowering is empowering family members to take care of patients, but also patients to take care of themselves, not to take that responsibility away. And the other is the educational part, is to empower others to treat more people. I always felt that you can't be everything to everybody, even though we try. You need to actually, the more people we train, the better we can do.
True.
So in managing all of that and the entrepreneurship is seeing possibilities. It's seeing the bigger picture. And then, once you've seen the picture, to say, how am I going to get to that picture?
Yeah.
And it might not be a clear picture in the beginning. There's certainly one thing that I know where I am now. It's sort of like we were joking about this in the car, my husband and I, and saying, okay, the first 20 years has now gone in Eloquent Learning Health, which is my training company. Now we are here for the next 20.
Yeah.
And I'm so excited about that because I
You're
do
wonderful.
believe, 20 years later means there's a wealth of knowledge,
Definitely.
which I've been graciously being able to accumulate through traveling internationally. My career has taken me all over the world. I've been to Russia, I've been to Europe, I've been
Wow.
Trinidad, I've been to
Wow.
America, I've been everywhere learning more about wounds and realizing that we are not different in South Africa. With regards to wounds. Wounds are everywhere. It's not going to be different in America versus South Africa.
Okay.
What is different?
The human body makes the whole.
You know,
the
a
same
wound is a
thing,
wound.
like,
It's the same thing. If you
wound is a
bleed,
wound,
you bleed.
Yeah, yeah.
Unless you bleed green, you might not be from this
You've never
country
seen-
or this earth.
Okay.
So
You almost scared me for a second.
Yeah.
we might have a
Green?
problem.
Yeah.
But the main thing is, I think what's different to us in Africa is we make a plan, we improvise, we do empower people,
Yes.
and we don't say no. We've got this tenacity to say, if one thing is not working, let's try another thing.
Another one. Yes.
I mean, how many letters does the alphabet have? 26?
Yes.
Okay? So if you've used one, you still have 25 to go.
25 or 26? How many letters?
I think it's 26 letters.
26. Isn't it 26?
Okay.
I'm just
Yeah.
testing your knowledge about that. But irrespectively, if you've used one, there's still a lot more to do.
Definitely.
And for me, that's on a daily basis with my patients.
Yes.
Even though I've been in the field now for 25 years, you still get the patient coming in and you feel like, not today, please. I would like to not see this wound today. You still have that. And that keeps me grounded because every person is different.
Yes.
Definitely.
Every patient is an individual with their own story. And if you don't listen and actively hear what the patient say there's a big difference between just listening and listening to hear.
Definitely.
So from my own personal experience and the wounds that I've had, when I wasn't heard by the healthcare professionals, it's become to me something that I'm very passionate about, is to, when I work with patients, is to listen to hear what's going on behind the wound.
Yes, yes,
so
very
true.
important, yes.
What's behind the wound?
Yes.
Why is that wound really there?
How do you hear that?
You
Because it
take-
sounds like it's a technique that you must have or something.
In a sense, it is. It's about we talk about a holistic assessment.
Yes, I wanted to say that you will need to have a relationship with your patients.
Oh.
So you will see your patient, talk to your patient, do a proper assessment. That's why it's very important. And that's why we always preach that wound care, even though it's not seen as a specialty at the South African Nursing Council, or we don't have certified wound care schools at the moment in South Africa, right? Yes, but it's a different, it is a specialty.
Yeah.
It has to be, you have to focus.
Definitely.
You can't have in the ward, have about 15, 16 patients that you are nursing as a sister and you are expected to come up to do a good wound care on a patient. You understand? That's where we get called as wound care practitioners. And Sister Lizelle, I get a lot of calls to say, Maureen, come and see the patient. Doctor wants you to come and see this patient. And I want us to talk about that. It's a challenge.
It is.
Because, Sister Lizelle, we can't say no to the patients. But then how do you deal with a situation where you are called to come and see or view, come and see the wound, and when you get there, it's a small wound. And medical aid doesn't really pay us because we don't have authorization.
Exactly.
Oh.
When it's a small wound, I'm a bit disappointed.
Okay?
Okay.
You want a challenge. Something,
Because
yeah.
an advanced wound care practitioner
Yeah.
is someone that has studied further, that has done certificates in wound care that's available, that has attended symposiums, seminars, attended international events even, and has more knowledge than the basic nurse on wound care. So if it's small wounds, if you are a nurse, what is expected from the medical aids perspective as well as the hospital perspective is you should be able to deal with that.
True.
Because it's supposed
As
to
a
be
nurse.
as a
Exactly,
nurse.
yeah. So you shouldn't be getting
You
a call.
shouldn't be getting a call from advanced wound care practitioner for a small little wound per se. And I also feel that's something that we need to change. And
Yes.
we need to actually say again, listen, it's not only the wound care practitioners out there that has to do the wounds. We need to empower nurses in hospitals to actually be able to do that as part of their jobs, treat the wounds in hospital. But if it's a wound that is a challenging wound, that is not
Then you
going the
can call,
normal
yes.
pathway,
Definitely.
be able to call the wound care practitioner.
Yeah.
The thing about that is exactly what you've mentioned. Currently, wound care practitioners are not paid to go into the hospital to actually do the wound care. That's the
I want that message to get to a lot of hospitals, guys, because they will feel like you are not, you are refusing. You understand? And then also as a nurse, we've got pledges. We have pledged to not refuse to treat the patient. You understand? So now you are called. You also want to build that relationship with the doctor, because you don't want to lose their doctor.
Yes.
You want him to keep on sending patients to you. And now this is a situation where you know that as the sister in the ward or the nurse that is taking care of that patient can actually do this wound. You understand? Because it's your time there. You are not getting paid. It's a challenge, Sister Lizelle. I don't know how can we come up with awareness that will actually make the hospital realize that a complete hospital has to have a wound care as part of the hospital.
Because also with what you're saying right now, that they don't have it in the hospital. If I've seen, or rather experienced some situations where people that I've known are so afraid to go to the hospital when they have like severe wounds, right? They feel like maybe they're not gonna come back because of that severe wound.
But they're going to get an amputation.
Something like that, or they're just not going to come back, So it goes back to the idea that some people who call you with a small wound are obviously people maybe with medical aid who have the knowledge that, you know what, sister, I need this done professionally or something like that. They pressurize them. You know what I mean? So I get the importance of the nurses to have, you know, a certain amount of knowledge until then they say, you know what, when it comes to this part, we need to call a professional.
So I think what will be better or best is to approach the hospitals. I think we need to make our message heard in the eyes of the hospital management to say we as NBS are willing to support and give basic training on the wound care.
Does it come with a module or something that...
Okay, we are partnered with Eloquent training facility on the wound space, as obviously as NBS. I think maybe we need to start now visiting the hospital. It's reality, you know. To try, because we are not refusing and not maybe wanting to be part of it. We're saying we are here, we can give you a little bit of training about it, and then you know that for the wound that is as big, or maybe it's a challenging wound, that's when you'll give a sister a call, or wound care specialist or wound care practitioner a call to say, come, can you come and see?
That initiative, you're saying it like, you know, it's something that is not so important. Like you're saying, as NBS, we're going to start it, but I feel like it's a national thing, or rather, you know, a continental thing. Like it's a huge task that needs to be put in place. Are you going to go that deep?
No, yes, because as wound care practitioners, I think before this podcast, we talked about it, me and Sister Lizelle, because those are the gaps where we want to make sure that they are filled, in the wound care space, because we are seeing, as I own a clinic and she also owns a clinic, we see that we've got patients that gets to amputation, and then of wounds that could have been prevented. Yes, you understand? So
I would also like to just on that point. So hospitals that are very successful, if you're going to look at certain hospitals and certain models, they will have a wound care clinic at the
inside
hospital. Inside the hospital.
Yes.
So there are some of the private hospitals that do have that. Even our government hospitals do have a wound care clinic.
Yeah.
Problem with some of the clinics is understaffed, which is one of the big problems in the world. There are not enough nurses out there. We know that. So think about that. Now they don't even have a wound care facility. How do you man that facility without the nurse being placed all over the hospital? So it's about creating an environment where a hospital can actually have a wound team on a rotation basis, making sure that even if it's different skill levels, the knowledge is carried over. And that's the challenge that we're facing. So there are societies and associations that have been trying and starting to tackle this issue, like the Society of Private Nurse Practitioners. They do a lot of work for private nurse practitioners as well out there. The Wound Healing Association of Southern Africa is also trying to change the status quo on that. But there are challenges that we face with that. And one of the biggest challenges we face is communication.
Yes.
It's transparency and between companies, between hospital groups. It's that age-old thing about management not understanding what's happening on the ground.
On the ground.
It's about, does the CEO of the hospital actually know what's going and happening in the ward at the bedside table with the patient with a wound? Do the pharmacist or the stock controller actually understand why the nurses on the ground wants this specific product?
Yes.
Because that's a big challenge, isn't
I've
it?
seen that a lot.
Yeah.
I've seen, for example, I've seen a situation where a patient was given a wrong colostomy bag by the pharmacist.
Because they don't understand.
Yes, and they've bought about 5 of them. And those things are very expensive. Now, when they come to me, I said, but this is a wrong bag. This is actually not for colon. You know, it's not a colostomy bag. It's something else, you know.
And that's, again, it's such a pity because it brings us again back to education.
Yes.
It's not only educating the nurse, it's educating the pharmacist or the stock controller on why certain products is needed. It's educating the doctors, the hospital, what's going on. You've mentioned the doctor wants you to come in because he trusts you. But what the doctor doesn't understand is for you to come in, you need to really jump through hoops with the medical aids to get authorization, which takes such a huge admin burden on a practice. So if you started out your business as a single wound care practice, to really manage all that admin that's associated with authorization, it's really taking a toll. So to give you a scenario, a GP, a general practitioner, doctor, does not need to seek authorization to do wound care for a patient in his treatment for months. And they don't have to give feedback to the medical aid why the wound is not healing. So you'll have a scenario where a patient's been visiting their GP. They've done the wound care for months on end. I've currently got a case like that. Wound is not healing. Now that the patient is with an advanced wound care practitioner, now the practitioner has to get authorization from the medical aid to treat the patient to get reimbursed. But the GP has already depleted all the money
funds.
and the funds.
All the funds,
Without a question asked about why has this been going on so long, because either the ICD-10 code that was used did not reflect the wound. So there's a lot of things out there that can be addressed. And again, it comes back to education across all disciplines. Because if the GP understands what a wound care practitioner does, they can either refer earlier or start with the right treatment from the start.
From the start,
So from my business perspective, from Eloquent Learning Health, we focused on the multidisciplinary team. So we train not only nurses, we train doctors, surgeons, podiatrists, occupational therapists.
I see you also train the lymph drainage therapists.
We've got lymph therapists that we work together with.
Nice.
So over the broad spectrum of the multidisciplinary team. Because in essence, wound care cannot be done by one person. So your patient is just as much part of this.
Effort,
And we were talking about that. Is we say we want to talk about the advanced wound care practitioner, the specialist in wound care, because there are a hierarchy in that, a hierarchy. But who is really doing the wound care at the bedside? For the general public, for the general... You've spoken about the person with the leg ulcer.
The situation at home,
Who was looking after that person?
Exactly.
The family.
Yes.
And they're not trained.
They are not trained. So why can't we empower family members, care workers to assist in training? To be able to do
Makes
the
sense.
basics, but know when to refer to a wound care practitioner or further onwards. And I think that is one thing that we need to focus on as well. There's not enough hands to deal with all the wounds in the world.
Talking about empowering the people at home and empowering the nurses and everything like that, right? I want to ask this question in terms of nurses, right? Is it a, how can I put this? Do they know a specific amount of information to a specific amount of, capacity? Or there are other nurses who are actually, I'm a nurse, but I know more about wound care, and in the hospital they call me for that, and then the other nurse, I know more about TB, or is it just general practice?
So it will start with one. You'll have to be a nurse first. Yeah, you'll have to be a nurse first, which will bring me to another question to Sister Lizelle, because I'll answer you, Kay.
Yeah.
I just wanted to ask Sister Lizelle before I forget, because after our first podcast, we have received a lot of direct messages. And then I've got a lot where RNs, which is professional registered nurse, wanting to do wound, they want to train.
Yes,
they want to do training on the wound. I love wound. I want to do wound. I am an EN. I am a care worker.
I've seen the comments.
Yeah, you've seen the comments. Yes. So, sister, please, can you please just advise us, because some especially on the lower category space, I'm unable to advise. In terms, if they can do wound, and then up to where can they be trained? Can they do advanced? No, they can't.
Now, for advanced wound care, you need to be a registered medical practitioner. So either a GP, podiatrist, wound care nurse. So you've got to have your basic qualification. But to do wound care can be done actually by anyone.
Okay, all right.
To be
As much
honest.
as she mentioned that we need to do the awareness and train the family members.
Exactly,
Yeah, okay.
exactly.
In the reality, if you look at what's happening outside, the patient gets discharged from hospital with a pressure injury.
Yes.
It's the patient's family members that look after that wound.
True.
It can be a carer at home, an enrolled nurse, care workers. We've got a lot of care workers, and we've got very good care workers in South Africa, or assistant nurses. Why can't we empower them with wound care?
Wow.
The thing is, what we don't want to see is that they work on their own.
Yes.
Because
There
if you
needs to
think
be
by
under the
law
supervision,
and by
yeah.
scope of practice, you still need to
Okay,
operate within your
yes.
scope of practice.
Yes.
Because there's certain things that you're not allowed to do. So should be working under the guidance of a registered nurse or a general practitioner and so forth. And we need to work within the law still in that.
Yes.
But if you look at what's happening in reality across the globe,
Yes.
it's lay care workers that often take on the training, or family members, or not the training, the wound care.
What's the process, maybe? Because if it's done globally, is it a tedious thing to do, or it's actually it's not that cumbersome?
So there are courses for enrolled nurses, for caregivers in basic wound care, in pressure care, and home nursing care, which they can do. So to get them those basic principles of how to recognize when is it a problem, when is it not, when to refer. Because that's the key in
Yes,
action.
yes.
When do I refer?
Yes,
When is
yes.
there a problem in this wound? Because why do we get wounds to go so bad? It's because we don't recognize that there's actually a problem.
Severity.
So it's about educating
Wow.
the care worker and the enrolled nurse. And when you see these signs and symptoms,
It's
take
now,
a step back.
Yes.
Don't be
I need to
reluctant to
call
report.
somebody.
Yes.
But the trick is, who do they call? Where do they go for that help? And that's something that we're lacking in South Africa.
Okay.
We don't have a network per se where any family member can go on to say, listen, I need somebody to help me with wound care.
Right
So
now,
we-
who do they call? Like right now?
So I think a lot of people
think
will
they
do
will-
the
they will
wound
take the
healing
patient to the-
association, but
yeah.
they take them to the pharmacists
Yeah.
are part of this
So
a
it
lot.
goes to private.
Private to the pharmacy, they can go to a doctor, but you've mentioned a lot of patients are too scared to go to hospital.
Yeah.
Or if you look at what's currently happening in our hospitals, understaffed, not enough beds. So who's going to take the priority? The leg ulcer patient or the trauma patient that's got the knife wound? Certainly, you're not going to give the bed in the hospital to the leg ulcer. You're going to give it to the trauma patient. So that's the reality of what's happening in all our hospitals at the moment.
So the structure is there, but there must be maybe.
We've got primary healthcare centres.
Yes.
But it's how do we tap in from the primary healthcare centre? Where do they go from there? How do you work up the system? Or how do we actually equip the primary healthcare sector, both private and public, to actually be able to treat those first-line wounds, if I can put it like that?
I think that's the most important thing to
We need
actually
to that.
enable the ground people
Ground
to be
people.
able
Yeah.
to.
But Kay, that's where NBS is coming.
Definitely.
NBS is coming to identify. We are identifying, and now I'm happy we are having this conversation because we are not going to stop ENs from coming to join us because we were focusing on only RNs. But now Sister Lizelle has just made us realize that actually we do have a very good nursing assistant that they can be trained under wound care space and they can become best, you understand?
Definitely.
We also have ENs, but the problem will be for them to get the practice number. Obviously, they can't open a clinic.
They won't be able to do that.
Yeah.
But remember, you can always have a nurse together with an
Perfect.
EN or an
Perfect.
assistant. In my facility, I've got a very good wound care assistant.
Yes, I know them, yes.
Okay. So I've got a general assistant and a wound care assistant and another registered nurse.
Okay.
But the beauty of that is my nursing assistant is just as much as my right hand because I've trained her from the ground up. So she knows everything there is.
Wow.
But according to law, she needs to work under my supervision. So you still
Definitely.
need to work according to your scope
Yes,
of
of practice,
yeah.
yes,
Unless
that's
they
very
do study
important.
further nursing. But that's not always feasible for that. But I do believe, why do we need to shut the door to people that are passionate, that are more than able to, and we can empower them to actually do that. And if we empower them, a lot of clinics will need maybe an assistant. So that it's not only the registered nurse. Why can't we provide that opportunity to them?
And that'll also, alleviate the amount of work that nurses have going on if they have, those type of assistants.
Absolutely.
Yeah.
And it's all about what is happening in the rural setting, where there's not a hospital nearby.
Eish.
Wound care needs to be accessible to everyone.
Yes.
Okay, and part of the work that we're doing, I'm part of the World Alliance of Wound and Lymphedema Care, and part of what we're doing is that low resource setting as well, is creating an environment where in a low resource setting you can still do wound care. Now the irony about low resource doesn't mean it's like Khayelitsha, for instance, or Deep Sloot. You can be in Sandton
True.
and still have low resources because of
Yes.
red tape. You can't get your dressings because it's not
Yes.
part of the formulary.
Exactly.
And those are part of low resource settings. So
Yeah.
how do we change that? How do we get access to the right products, or at least to products that we know can work? You don't always need to have the most expensive product out there. I mean, I'm very
Yes.
privileged. Okay, in my wound care center, what makes Eloquent Health and Wellness different to others is the fact that we do use technology.
Yeah.
So I have got the latest light therapies that I use. I'm very, very fond of near-infrared and red light therapy.
Wonderful.
For wound healing.
For wound healing.
Okay.
It makes a huge difference in all facets of wound healing, bruising, sports injuries, and so forth. And I also use intermittent vacuum therapy, or whole body vacuum therapy with the vacuumit device, which is like a chamber where patients get into that halfway, but improves your blood flow and your lymphatic drainage. So that gives me a unique ability to deal with wounds where it might have gone for an amputation, but now we can improve the blood flow and the lymphatic drainage, so we see faster healing.
That's wonderful.
And there's also other technologies. You can draw a patient's blood. It's red blood clot therapy. We coagulate that blood, so it's the patient's own blood, and we put it back on the wound. And that also enhances wound healing. So there are so many things out there that is not necessarily out there in the space for people to know, you know what, it's not just about putting on a plaster. And it's not just about doing a dressing or putting an ointment. It's to understand what is in that ointment.
Yes.
What does it do?
Yeah.
Is the company is promising me this with this certain product. Will they do this every time?
Will there be a consistency?
Will there be a consistency? What I've also learned through the years, when people start saying, no, the products are not working, or if they've used this before, you'll have a patient come in and they'll tell you, I've used everything. I think you've seen that as well. No, sister, you can't tell me
It's
anything.
not working.
It's not working. But you need to ask them, how have you been using it?
Yeah.
How
long have you been? Yeah.
How
It's
have you
very
applied the
important.
dressing? Maybe they put the wrong side on the wound, okay? Because that can also happen.
Definitely.
And it's often not the product that's wrong. It's the person applying the product that's making the mistake.
It's very important. And you know what, Sister Lizelle, I remember you had an event on the product application. And then, I mean, a lot of people would say, why would you arrange an event just to apply a product? It's very important to apply it
is.
correctly.
Definitely.
Now it makes sense.
Because you don't want to put the whole ointment on a wound. Maybe you must put it around it or anything like that.
Or maybe you must put it on the gauze before it goes to the wound. Oh, yeah, Yeah, so...
Or cutting a bandage a different way or making it easier.
Jeez.
In South Africa, we're very fortunate. We do have access to a lot of different products and wonderful wound care companies that do support wound care in South Africa. There's quite a number of them. And the thing is, if you don't understand the product or how it interfaces with the wound or interface with other products, you can actually nullify the effect of the product.
Yeah.
And those are the things that we need to train nurses and doctors and everyone about. And that's part of what Eloquent is about, is to open people's minds as to how to use different products. And because not every product works for every patient. Okay.
That's true.
So,
It's
Sister,
about that
Sister
relationship.
Liz, let's talk about billing.
No. Do we really have to talk about billing?
Let's talk
I
about
sort of get nervous now. You can see I play with
reimbursed.
my hair.
Let's talk about how a nurse would make money out of wound. how do they make their money from seeing a patient that comes with medical aid?
Before you answer that, sorry, I know, people love money. And, at this point, now that, we are getting into how you're going to make money, you're probably on some. And now, while you are there, please don't forget to subscribe, like, leave a comment, and make sure that you don't miss any episode. And don't forget, a notepad is very important. We are very deep right now. You need to keep every note of what we're saying so you can apply it. We can tell them how to make money now.
To add on that, we are having a billing and coding workshop training that is coming on the 30th of August.
Yes.
It's in about 2 weeks.
Definitely.
This coding and billing is the guideline. It's going to be a guide for everyone who wants to be in the wound care space or wound care business, because you will need to make your own salary. You'll need to pay your employee. You'll need to make money.
Definitely.
So how do you learn in that space?
Code,
So that is the question I wanted. What was the challenges with Sister Lizelle? Because you know what, we've got people running to ask people for cash practices.
Oh.
Yeah, having the patient to pay cash. Because they are running away or shying away from the admin. The admin, phone calls with the medical aid, follow-ups, ICD-10 code, the NEPI codes and all of that. Sister Lizelle, what was your challenge, or what is your challenge around that?
I need to think very carefully how to answer that question. Okay. Well, to give you an example, my practice is a cash practice.
Okay. All right.
So patients pay the practice and claim back from the medical aid.
Okay.
That doesn't mean
you don't have to do billing and coding.
You still have to do billing and coding. If your patients want to claim back from the medical aid, you still need to assist them to get their authorization.
Okay.
Part of that is writing reports. Part of that is getting an authorization request according to what the different medical aids want.
Okay, Sister Lizelle, you said even if you are practicing, you are running a cash practice, you still need to get an authorization from the medical aid for the patient.
Or the patient needs to do that.
Yeah.
The thing is, the patient's not the one taking the photographs. The patient will not be able to give the ICD-10 code, and the patient will not be able to explain your billing.
Okay.
So you need to know how to bill the patient. You need to know which billing system to use.
Okay.
And there are quite a wide variety, and that's why the upcoming workshop is so important. It needs to align with also what the medical aids want. So the medical aids are not necessarily going to reimburse everything that a private nurse practitioner charges.
Yes.
That's why it's so important.
That's why it's so important. And that's why it's also important that you're upfront in your practice of how your fee structure is. Whether you are working through medical aids or as a cash practice, according to law, you need to inform your patient beforehand to say, this is how my practice works, before you start treating the patient.
Oh, okay.
Because
yes.
if that patient comes and you start treating them and you haven't explained to them that, you are going to run into trouble, either by the patient not paying you, or you're going to think that you're just going to start, because you care for the patient, you keep on doing the care.
Okay.
And that's often where we are being, I won't say abused, but I think misused. Because people have this perception about nursing, and they've got this Florence Nightingale image.
Yes,
okay?
yes.
Now, I don't know if you know Florence's history.
Nope.
Okay.
I don't.
Florence's surname might have been Nightingale, but she was really not that sweet and just the lady of the lamb.
Okay.
She was stubborn.
Very strict, yeah.
Strict, straightforward, would not take no for an answer. She was proper like, don't mess with me. Okay? So the perception of the public is that if you're in healthcare, and if you're a private nurse or if you're a nurse, this is your calling. You have to provide me with care. This is what you have to, irrespective if I've got money or not, this is what you do. My question to you is that if the fridge broke, okay, you phone
the maintenance people to come
or the maintenance to come back.
Yes.
Do you tell the maintenance guy, you know what, this is your calling?
I have passion.
I see you have a passion for that. I'm not going to pay you now. I'll do the
It's so-
job. I'll
did
pay
say
you in
that-
6 months.
You did say that nursing is not a calling; it's law, right?
Yeah, nursing is law, and it's not a calling as people would misuse us to say, you are a nurse, you are, therefore you will do this, you are bound to do this. It's just, we are not taught to refuse. You know, you can't refuse to help the patient, you understand? But we do have challenges where patient doesn't want to understand, you know. It is their responsibility
You
to
gonna
get...
let me go. You're not gonna help me.
Yeah, you know, it's different when I came to a space where your patient is paying you for the services, and in the middle of the wound's not yet healed, and they run out of cash. Then you can talk to the patient. You can't leave that wound alone. You understand? But then patients need to understand that.
That's where the misuse comes at, though.
Yeah,
Well, misuse doesn't come always in at that point in time. It comes sometimes from the start,
from the start. Yeah.
where they would come. And I think you're the same as me, because we're so passionate about what we do, and a lot of wound care practitioners are like that. You won't let a patient walk into your office and let them walk out. It's just in my nature.
It's in us,
I will
you know.
first treat the patient, and I have seen that on several occasions over the last 25 years. You give that care to that patient, and they will walk out, and they might not come back, because then they see the fees and all of that. But what I do believe is that you need to value yourself as well. What do you see is your value to that? And remember, patients have options. If they want to have the Rolls-Royce wound care, you need to pay for the Rolls-Royce wound care.
Exactly.
If you're on a medical aid, you want the full house, but you're paying for the lowest plan, which might not include the wound care. But they are on a medical aid, So people, it's also about educating the public on, if they're on medical aids, what does their plan actually pay for?
Definitely.
Yes.
And
billing and coding training.
billing and coding
Very
training again,
important,
because if you don't understand that, that's where the mistakes come in. And I do believe it's important. We talk about informed consent.
Yes.
Does your patient understand what the procedures are that you're going to do? Do they understand that this is somebody that's going to use a Doppler to look at your blood flow? A Doppler, if you buy a brand new one, can cost anything, depending on the make and what, from 4,000 Rand to 20,000 Rand.
They're very expensive.
They are expensive.
They're very expensive,
Okay.
yeah.
That's why it's advanced wound care.
Definitely.
So they're using technology to determine why you are there. They've got different things in their facility. It's not somebody that's just coming and saying, okay, guys, you need a Band-Aid. Great, let's
do the Band-Aid. That's
Put
why
the Band-Aid
we
on.
end up having wounds that are not healing. We end up having long, the wounds that are stretched in terms of healing. So I think training and education is very, very important.
Definitely.
It's very important. Hence, I want to emphasize on the billing and coding. Guys at home, please attend billing and coding. Maybe your practice is cash practice. You still need the billing and code. You heard Sister Lizelle. You need it because you will need to know the codes to put on you need to assist the patient to be able to get their money back from the medical aid. And the patients are not clinicians, they are not in the medical, they don't understand. Yeah. So it is your responsibility, if you want to be a responsible wound care practitioner, make sure you attend the event so that even with that invoice or statement you are issuing to the patient, they are able to get their money back from the medical aid.
Yeah. How many people did you say we're having?
We are having, I think we have about 3 spaces left.
Okay.
Yeah, but we're not going to stop a block. If maybe we are having more people coming wanting to attend, we will make a plan.
How
we
much
will
are we
definitely
going for?
Okay, because NBS, remember, is an entity that empowers nurses to become entrepreneurs. So we definitely have members that have registered under us, which is a group of people that are going to be referred to Sister Lizelle for a training, you understand?
Wonderful.
So for members it's 1,500, non-member is 2,500. Yes, yeah.
There's only 3 people left, guys. Don't forget, you need to make sure.
Yes, Sister Lizelle, I once was called in one of the hospital to come and assist with a wound. And when I got there, it was a patient that had Stevens-Johnson burns. And then I just wanted to explain to us, what is the difference between the Stevens-Johnson wound and the normal wound, burn wound? the normal burn wound and Stevens-Johnson burn wound? What will be the difference? Would you say, because I want to be honest with you, I treated those burns like normal burns. So you please advise me. I stand to be corrected. I'm learning.
So I assume you're asking me that question because you know my
I know of your,
history.
yes.
Okay. So number one, maybe just to share with everyone that's watching,
Definitely.
is about a year ago, I developed Stevens-Johnson TENS.
Yeah.
So that means it's Stevens-Johnson toxic epidermal necrosis.
Okay.
Now what happens with that is Stevens-Johnson's has 3 different ways of how it's presented. So how do you get that, number one? It's usually because of an allergic reaction to medication.
All right.
And prior to that, it also, an indication or a precursor to that is somebody that's got an autoimmune disorder, in a sense, an autoimmune
Disorder.
like your arthritis patients or, for instance, TB patients are also prone to develop that.
Oh.
So you see that in the TB realm. It's a reaction against medication. It can be any medication. We've
And
got
also
epileptics patients that have had that and so forth. So you'll have it either where you've just have an allergic reaction like a rash
Caused by?
caused by the medication that you've used. In my case scenario, I'm now allergic to sulfurs,
Okay.
which is one
Did you
of-
know about that, or you knew after the reaction?
I was always sensitive.
Okay.
But I wasn't fully allergic. It was only until it happened. So I used a nasal spray on a plane traveling to the US and felt
Sure.
like when I got to the US, I was like feeling maybe it's jet lag, general just being
Yeah,
tired,
yeah.
didn't realize what was going on. And my first presentation was with blisters across my nose and onto my cheek. And I wasn't feeling well. The next day, I woke up completely swollen. So within an hour of that, so say by 9 o'clock, I took a photograph, saw, okay, I'm not looking good. My eyes were swollen shut,
You're still
literally.
thinking maybe it's an allergic reaction, or?
Didn't actually realize what was going on. I was just aware of immense pain. It felt like somebody took a blowtorch and was burning my face. It was excruciating. It was excruciatingly painful. I was admitted to an ER in the US and I was misdiagnosed. They diagnosed me with a bacterial infection and an allergic reaction and shingles, which was not what I had.
Shingles.
Yeah, so I was discharged.
You're learning all of this.
You're learning new languages. You've
Sounds
got
very
to
cool,
sit
yeah.
down.
I like it.
And the thing is, because I was used to how we do things in South Africa, when they took off my drip and only had a short drip on, I thought, well, then I'm better. And they gave me morphine, so I felt really lekker.
Yeah. Good to go.
And so I went home to my colleague because I wanted to go get on the plane the next day to travel to Las Vegas to the conference where I was going to be at. And long story short, ended up in Vegas. And by that time, I could barely walk, was swollen all over. Started losing my skin, getting blisters all over my skin, and developed burns. So I was then diagnosed by a doctor
What
with
happens in that process? Like when
It's-
all that swelling is, what's
your,
happening
your
in the system?
body is actually rejecting almost your own skin. So you're burning from the inside out. So in Stevens-Johnson, you have a partial to superficial burn. So it's the epidermal layer, the top layer of the skin, that actually is shed. So you burn your top layer.
Okay.
And it's usually partial thickness, but can be large surface areas. So Stevens-Johnson's is usually about 10%
Of
your
burns.
surface area that you
Okay.
lose. Stevens-Johnson 10 is about below 30%, but you also lose your mucosal membranes. So in other words, all the skin inside your mouth, intestines, all of that, you lose that skin as well. So what's happening on the outside is happening on the inside. So in my case scenario, that third day, I was literally coughing up my lungs. I could see the lung mucus, the membrane.
How do they look like?
It's like well, you can't see the full, but it's just a pinkish blood that you are sort of like, so it's very gory.
Pain as you call it?
A lot of pain everywhere.
Excruciating.
It's really not good. And then the other thing as well, if you go over to TENS, which is toxic epidermal necrosis on its own, those are patients who will lose all their mucosal membranes, plus more than 30% burns over their body. So that was what I had.
Sure.
I developed 30% burns, 31% all over my body, lost all my mucosal membranes.
While
had
you were in the States.
While I
by
was
the
in
way.
the States. And by that time, the ER doctor that diagnosed me, and I'm forever grateful to him, put me on the right antibiotics on cortisone, which then decreases your swelling and your lymphedema, which is
reduces the swelling.
crucial because that's also part of the dangers in that. Being a wound care practitioner, coming back to your question, I knew that with any burn, you need to cool down the burn. Not that I actually realized that it was burns, but it presented the same way.
Yes,
I
yes.
lost my epidermal layer.
Yes.
So to stop the pain, you need to cover those nerve endings with something.
Yes.
And the best thing is gels.
Okay.
So any gel that you can get your hands on.
Yes.
So in that case scenario, I was able to get my hands on wound gels,
Okay.
which somebody kindly bought me. And I could spray that continuously on my
On your
face and on my
face,
arms
yeah,
and on my
on your
chest.
affected areas,
And all
yeah.
the affected
You
areas.
could?
I did my own wound care. Yeah. So there wasn't anybody at that point that could come in and do my wound care. So I was
I don't think
constantly-
she was going to even allow anyone to do it.
As she
I
knows.
did on the Saturday. I had a beautiful colleague. She's an Australian, but now an American, Terry Swanson, who did.
Shout
So
out to
a
Terry.
promo-
Shout out,
shout out to
Terry.
Terry Swanson. There were really people that helped me. Cindy Brantis that brought
out,
those
Cindy.
first out.
Yeah.
Cindy brought that first gels to me.
Wonderful.
And another shout out is Trish Idenson.
Okay.
Who was a colleague of
Trish.
mine, a South African that's in the UK, and we were communicating via WhatsApp.
Okay.
Oh.
So Trish was my sanity, and she was the person.
Hi,
that we-
Trish.
who
We
would
love you in
say,
South Africa.
Liesel, maybe try this and try that, because
Oh.
the first wound care dressings I got was on that Friday, so that's already 3 days later.
Okay.
But with the gels, it was soothing, because I didn't develop scabs. Now, a lot of the times with the Stephen Johnson patients we see in hospitals is they apply ointments onto the facial burns. Now, ointments stuck to your skin, it becomes dry. And if you don't constantly clean that off, and again, the principles of wound healing, debridement, infection control, moisture.
Yes.
You need to remove all those scabs. You need to clean that area and provide a clean wound place. And that's why most of our Stephen Johnson TENS patients, when you've got the severe swelling on your body like I did, they get admitted to ICU, intubated, and then treated because the pain is so
Were you
severe.
intubated?
I was never admitted.
Oh, okay.
You were never admitted?
No. In my
Okay.
case scenario, that saved my life. And I think God had a certain plan for me. Jesus kept my airway open.
Amen.
Which
Shout out to
confused,
Jesus.
which confused a lot of people. And it's because of him that I'm alive today and I can share my
Wonderful.
story. But that's also what confused people, because if you've got so much pressure on your airway, it should collapse.
Yeah.
Isn't it? I mean, we know from working in
yes,
hospitals.
and
You
it's
were
straight
never admitted?
ICU
Straight
intubation.
ICU, so that
Yeah.
was that. So no, I was never admitted. Did my own care in a hotel room, and for that 2 weeks in America, my daughter helped me the second week when I was staying at her
Shout
home
out
as
to
well.
daughter too.
Hi,
Yeah,
doctor.
Nicola, thank you.
Wonderful.
Nicola helped me a lot in a sense that we developed the way that we would put our plaster. So I used the one product that was not hurting me at all was Hyperfix Skin Sensitive from
Okay.
Esative. So I would like to say, Esative, thank you for that product.
Okay.
Wonderful.
Because
Wonderful.
I could apply it on the raw areas as well. And you don't have to change it so often. And when you do change it, it won't pull off your skin.
Okay.
So that was, and we
Oh,
could
so
do,
it's so moist enough to keep.
it's moist enough, but also vaporizes enough.
Okay.
And the thing also with that is because I developed keloids and scarring on this side of my face. So
you
will
don't
see
look a scent
it's a
of
little
what
bit
you are talking
different.
about.
Yeah. And I had full thickness burns on my eyelids, which
Wow.
was really bad.
You really did very, very well
Being
in terms
gracious.
of taking care of yourself.
But to
You
your
make it
patients, you need to use
Yeah.
gels. I mean, you need to moisturize the area.
You see, this is where we say it's very important to know the types of wound care dressings.
But she makes it sound so like it wasn't
The wound
that
care
severe.
product.
Like
Yeah. No.
She was
It is
not
because she
admitted.
looks very nice and beautiful
Yeah,
today.
Exactly. Was it that severe? Like, how's the survival rate of the Stephen Johnson?
Stephen Johnson TENS in the condition that I was in, 30% of people survive. So Yeah, I'm
That was
one of
severe.
America. I'm 1 out of 6 million people that's alive and well and being able to talk about my experience today and to create awareness for that. Because the earlier you can seek help. So if you are out there and you have an allergic reaction to a medication, don't just sit around and say, oh, I'm going to use like Allergix or something like that. Go to a medical professional.
Yeah.
Go seek help, because you might never know when that allergic reaction can turn into something else.
Yeah.
It goes back to,
And it's so important.
NBS, the importance of teaching, people
Yes,
about.
that's why we are partnered with these companies that brings education to be able to tool our nurses, our practitioners that wants to become independent and
Yes.
open their own practices.
Definitely.
It's very important to know what you are doing. I'm telling you, and it gives peace in yourself. You understand? Billing and coding on the 30th of August.
Yes.
Yeah.
You don't have billing and coding experience, then you can't open a clinic. Am I right, sister?
Yeah, well, you can open a clinic, but if you want to make money.
Yeah.
If
We were
you
talking
want to
about how
get
to
an
make
income,
money, by the way.
Yeah.
I mean,
Billing and
NBS
You
is
coding.
can,
also
you
about-
can open the clinic, but you won't
But-
make money.
You-
Yeah.
you
Must
need-
have boundaries. Don't let them just say passion.
It's so important, boundaries. I always say if people like you, they listen to you.
Yeah, yes.
If people trust you, they will do business with you.
Yes.
And how do you win people's trust? By being transparent and open
Exactly.
and making sure that you know what you're talking about, making sure that your billing systems and stuff are sorted. It's so important that we do that because we're professional people.
Yes.
We're not just opening up a small business on the side of the
Yeah,
road.
just a quick cash.
It's a professional
Yeah.
career that we're
Definitely.
in. And we need to elevate wound care as a whole.
Yes.
And say, guys, listen, this is not just something that we're doing
No,
on
it's
the
not a quick
sideline.
thing.
This is a career that you can have. This is making a difference in people's life, making a difference in your own life and that of your family members by having a good income from that and being regarded as a health professional.
Definitely.
And that's what we need to strive towards. And you can only do that if you've got backing from companies and institutions that understand what you do, like NBS, and having good quality education like we are providing at Eloquent Learning
Yes.
Health, and partnering with the right institutions and the right companies. So when you are looking at this, if I can give advice to any wound care practitioner, any nurse out there that wants to do wound care,
Yes.
education is key.
Yes.
Attend as many symposiums and seminars as you possibly can. Never stop learning. I have been 25 years in wound care, longer in nursing. That gives away my age a little bit here.
But you don't
But
look.
no, I'm like a spring chicken again.
She
So-
looks 25.
Oh,
Young,
just
exactly.
more and more.
Exactly.
But I still believe, and that's why I attend as many educational events as possible.
Yes.
Because you can always learn from your patients, from your colleagues, and from other people out there.
Yes, yes.
And one of the key things I believe, the more we share our knowledge with others, the more you learn.
Definitely. Definitely.
Knowledge shared is knowledge gained.
Exactly.
The moment that you hold on to, this is my knowledge, I'm going to share it to no one, what happens when you're not there?
Yeah, that's
Who's
true.
going to look after the people there?
Exactly.
So we need to actually empower others
True.
and become empowered ourselves.
So, Sister Liz, I'm not sure if this will be the last one. We've got, this conversation is actually beautiful. I wouldn't want to stop, but how do we market our patients in the hospital as a wound care practitioner? Remember, we're not talking about a product. We're talking about
your business.
We're talking about a business. We're talking about a patient. We want to showcase our work. How do you do that? How do you build relationship with the doctors so that they trust you and refer patients to you?
It's about visibility.
Okay?
I think that's one of the key things in any practitioner is you need to make yourself known. You need to be able to go out there, have your business cards, give a little write-up or about who you are.
Visit
and
the doctors.
Visit the doctor, present yourself to them, and also give them a report.
True.
Don't just take on the patient and
Feedback.
don't give feedback to the doctor. It's about really that communication. And I think that's key in developing relationship because it's all about relationships. It's about networking.
Yeah. And attend events.
yeah,
you know.
Definitely.
attend events.
Attend events.
And putting yourself out there. And I mean, you're not going to get every wound healed. We all make mistakes.
Thank you, ma'am.
Okay.
Yeah.
But the beauty is if you put yourself out there and you go to educational events, you can learn from other people's mistakes.
That's true.
You know, learn from my mistakes that I've made in the 25 years. And I've made a lot.
Yeah, through
And
conversations you learn.
but you learn as you go along. So when something bad has happened with you when you start out, see it as a learning curve.
Definitely.
What can I do better next time?
Yes.
And just, you know,
yes.
when you fall, get up.
Yeah.
Get up again and again. The reason why I'm still here is that when something failed, I could get up again and start again and move on again and never give up.
Wonderful.
And
never
never
ever give up.
Yes.
I mean,
do it again.
do it again.
Do it again and again,
And you're going
yeah.
to learn and you're doing it better. That's why I'm excited about the next 20 years because there's things that I'm busy changing.
Yeah.
We're changing in the educational realm. That's why we're looking at online platforms
Yes.
to actually get more training to more people out there. I still believe that having practical sessions are very important.
Yeah.
Where they
You can't
practically
learn everything on YouTube and videos. You
Definitely.
need to practice.
Practice.
And I think that's one thing that Eloquent really provides. It's that safe environment where you can practice. But it's so, so important that you need to make sure that your education is up to date. The moment that I'm going to say to you, Maureen, I don't need to attend events anymore because I know everything. Give me a kick in the butt. Okay?
Yep.
I'll come
You
fetch
never
you.
know that you don't know until you know that you don't know.
Exactly.
I'll come straight to
Exactly.
fetch you. So, guys, I just want to say, Kay, to emphasize, if you have not yet registered with NBS, this is the right time. Eloquent, Eloquent Health and Wellness, they provide training. I have been receiving a lot of messages about where to train a wound, where can I do my wound course, I want to do wound course and all of that. We brought this show today because we want people to know about the Eloquent training facility for wound care. So guys, please start reaching out. NBS, we are on all social media platforms. Please reach out. Let us help you. Let us come to you and help you. Let us have that good results. Let's have that beautiful outcome of the patient praising you to say, you have saved my life. I am healed. I've never felt so good like now. Have pride, guys. We've got Sister Lizelle. She has partnered with NBS, and we're gonna be walking the journey with her into supporting not only in Gauteng, we're talking even internationally.
Wonderful. One last thing, Sister Lizelle. You are hearing us asking people. You need to be part of NBS. What would you say is so important? Why is it so important? To be part of NBS, or why is NBS so important?
I think to rephrase your questions, why am I involved with NBS?
Yeah.
Okay. Why did I say, Maureen, I
Why
want
did
to
she
work
choose
with you?
to join us? Yeah.
Why have I joined this initiative? Is because we need to champion something that can help others. And because we don't have all the skills as nurses to be proper business people, if I can put it like that, entrepreneurs, NBS provides that solution. NBS has got a network on its own that can contribute and work together in helping nurse entrepreneurs having their own businesses and moving forward. And not only that, I think the key to me here is the networking capability of NBS
Makes things
on
easy
actually
for you.
advocating on behalf of their members.
Also compliance.
Yeah.
We also focusing on making sure that your clinic is fully complying with the relevant or current regulations.
And it's important
Definitely.
because that's the basis of it. If you've got all of that in place and you've got somebody assisting you with that, I never had that when I started out. It immediately puts you on a higher platform.
Definitely.
It immediately sets you up for a much better success rate than somebody that's starting without having the resources that NBS provides.
So when you started, it would have accelerated.
Oh, just think about where I would have been.
It's up there.
But I told you now, it's the next 20 years.
And
So
why
let's
is it
see.
so important for nurses to even go into entrepreneurship, though?
I think it's the nature of Africa and South Africa. We are an entrepreneurial country. If we need to help as many people doing their own things so that we can have more of this. Small businesses are the future.
And
And
also
also
help like help like the amount of work that nurses already have that they cannot sustain.
Yeah,
I
and
think
also,
that's
okay, when it's done by a specialist or a practitioner, someone who has been trained to do it, it comes out with good results. You understand? So the people who can do it best here is nurses.
True.
Because we were taught on how to take care of the patient, and we're doing that on a daily basis. So you can make it a specialty for you, and then you focus on that. You understand? So it can't be anyone. It can't be anyone else to come just say, I want to be a wound care professional. It has to be a nurse.
I want to put something out there as well. If you think about the current situation with our hospitals, so beds are important. But hospitals' turnover is also important.
Yes.
Get the patient out of hospital quicker.
Yes.
So there's a need for home care-based nursing. There's a need for outpatient clinic-based setting.
So that we don't have influx of patients.
Yeah.
Get
So
the
you want
job
to
done.
get people into hospital for surgeries, get them out as soon as possible to prevent infection, prevent complications. And this is where having a network can assist not only hospitals, but the community.
Yeah, she did mention that she started when she started her home her wound care. You were doing home nursing, home wound care, right?
Yeah.
Yeah, I also did the same. I would drive to the patients' houses and then treat the wound. We still have patients that can't come to the clinic.
Yeah.
True.
We still have patients that can't drive to come to the clinic. They are seeing and looking at their wound every day deteriorating, but they don't know what to do. Understand? So I think training is good, guys. We are bringing this to you. We are bringing this to you as NBS. We're saying, please come, join NBS, and then learn more. What you are choosing to do in your practice or in your clinic, please come to NBS. Let us help you. Let us walk the journey with you. That is my slogan. Let us help you.
Yeah.
Let us walk the journey with you.
Wonderful. Wonderful. One last thing, I'm still I'm a little bit, I had chills when you were telling me about Stephen Johnson. And I think maybe it's a very important thing to say out there to people. Maybe somebody who's watching this and who has, the reaction or anything like that. What, advice or message you would like to give based on your experience?
I think the most important thing that you can do is seek medical advice as soon as possible. And if that person doesn't know what's going on with you, ask for a referral or see somebody else. If things don't make sense, go further. It's so important that, I would say that for any patient, that gut feeling almost that, okay, wait, this just doesn't really. The answer is not for me.
Yeah.
You've got the ability to actually ask somebody else. We're in a day and age where we can ask questions. Now, I'm not saying go and Google everything. Okay, that's not what I'm saying.
Just get a second
But there's
opinion.
so much information out there. Is go and sift through that. Look at practitioners. Go and look for advanced wound care practitioners. Go and look for specialists that can actually do something. Refer and. If it's not going the way that you think the treatment should be going, or it's taking way longer than anticipated, maybe it's time to seek somebody else's care. It doesn't mean that you're not saying that person is not doing a good job, but you're allowed to actually get a second opinion. That's part of our country's constitution as well. So I would generally advise anyone, if you've got any allergic reaction to medication, don't sit around playing with it.
What are the immediate symptoms, maybe?
So with Stephen Johnson, the immediate is you've got this rash that's occurring on your body, and they turn into almost blistering.
Yeah.
So it presents a lot like burn wounds. So if you suddenly present like you've got burns, but you were not anywhere near a flame or water, something seriously is going on.
There's something in in my culture, right?
Okay.
You would wake up with a little bit of a burn, and You know?
Yeah.
Have you ever heard of something like that?
Yeah, I don't know if I can associate that with Stevens Johnson.
Okay.
Because Stevens Johnson on its own is very deep. Yeah, it's very deep.
Okay. I
So,
think maybe
but
it's the similar
Muloba
reaction
Dimu,
or
the
something
Muloba
like that.
Dimu that you are talking about will eventually disappear, right?
Exactly. Yes,
Yeah, will
yes,
eventually
yes,
disappear in
definitely.
our culture. So I don't want to associate that.
Okay.
I think it's different to
Yeah.
Stephen Johnson that
Yeah.
specifically
Yes,
because
yes.
Stephen Johnson is directly related to a medication that you've taken, which is different.
Okay.
Okay, which is completely
Definitely.
different in within
So,
that.
Sister Lizelle, where are you? Where can we if someone is looking to come to your facility for all the services that you have mentioned here, where do we find you? Where are you in Pretoria? Where are you situated?
Well, firstly, I'm in South Africa, so I'm on Earth. Okay. Proudly Pretoria. I'm based in Silver Lakes, Pretoria.
I love Pretoria. By the
Yeah,
way.
yeah. So Afrikaans, but I
Yeah.
can speak
Oh,
some
okay. Hoe gaan
languages.
dit julle?
Baie goed.
Baie goed. Or like when I've got international guests, we teach them a few things. Number one is lekker. I mean, that's
Yeah.
universal.
Local is
Lekker.
lekker.
Lekker,
Local
yeah.
is
And buy a
lekker.
donkey. So buy a donkey is like buy a donkey.
What?
So when I
Oh, buy
teach
a
in a-
buy a donkey.
Buy a donkey.
Yeah, so when
Okay.
you teach an American Afrikaans, you
Yeah.
say to him, buy a donkey, meaning thank you, is like buy a donkey.
Wow,
Okay.
Yeah, so
Easy.
buy a donkey.
Yeah.
Buy a donkey that I can be here.
Yeah.
Yeah. Buy a donkey
yeah,
for
so-
Are you happy about the rugby? I know.
Why do you have to spoil the interview?
I know. I had to.
But you know what?
Yeah.
We're South African, we rise again.
Definitely.
Yeah.
We always
Okay?
do. We got
just
Australia,
need to-
right?
Yeah, they're Australia. We
Yeah.
just wanted to get them happy for a little bit. We will rise again. Driekus will come again, and he will win again. It's just a phase.
Man,
We will
Driekus.
we'll get up again.
So disappointed,
Yeah.
but hey, we'll come back.
We'll
Yeah.
come back.
Yeah.
But yeah, if you want more information about where I am and what I do, you can go onto social media on Eloquent Health and Wellness on social media. And you can also look at our website,
Okay.
eloquent.co.za.
Okay.
So you'll find a wealth of information there, as well as the 3 different tiers in our company. is on
Okay.
there.
Wonderful.
So you are a member of NBS and you want to do a wound care training, this is the space for you. Please reach out. It's either you have to come to NBS. We are on social media.
Yeah, definitely.
TikTok, Nest Business Solution,
Facebook,
Instagram,
YouTube.
Nest Business Solution, Facebook, Nest Business Solution, and then our website, www.nestbusinesssolution.co.za.
Don't forget to like, subscribe. Yeah.
We're gonna be having. I told you about the event on the
Yes.
8th of November. Ne? It will be on a Saturday. We will be at the Galleria in Sandton. So what I want to say to the viewers today is that if you are still thinking of starting, you want to know about the dressing type, wound care, all services in the healthcare space, please come. Come to the event on the 8th of November. We will be at the Galleria at Sandton, and Sister Lizelle will be there. She will be having her own table, then she'll be explaining about the product. At least you will have, the pleasure of meeting with her face to face, right? She's international, remember?
Yeah, I mean,
so
she's well-traveled.
ask me how I've managed to get here today.
How?
It's another story.
I can imagine.
Yeah, please, guys, the tickets are out on CompuTicket. Please just on the CompuTicket, you type Nest Business Solution. The name of the event is the Second Global Nest Rise.
Yeah.
Nest Rise,
Yes.
Second Global
Nest is gonna
Nest
rise.
Rise. Yeah. And then we will be having our international guests in the wound care business. Guys, you do not want to miss this. So please come and then let's have fun.
Yeah.
Looking
Do we have a
forward.
dress code?
You dress to kill.
Okay.
You forget that you are a nurse.
Okay.
You are now a CEO. And the good thing is that there will be a makeup artist for nurses for free. We're giving it, we want nurses to look like this.
Wonderful.
Nest Business Solution, please follow us on the social media platforms. Nest Business Solution on all platforms. Thank you.